Hello folks, it's Gav from Forge Gym. Today I'm going to be talking about things you can do with your diet, with your nutritional strategy, your supplements to minimize the risk to your body and health implications if you choose to run anabolic steroids or prohormones or other associated products. Main issues that come up with people who use these drugs: increase in blood pressure, decrease in liver function, and problems with cholesterol levels. Now, the two of those that I'm most concerned about would be blood pressure and the liver function. Blood pressure is important simply because blood flows through the arteries, obviously, throughout your body. If the pressure that it flows at is increased, then those arterial walls can stiffen and thicken. And when they do that, they tend to function less effectively and they're more prone to big problems, shall we say. So, for instance, if it's in the heart tissue, you're more likely to get heart problems. Narrowing the vessels in the brain leaves you susceptible to stroke. Narrowing the vessels in the kidney reduces blood flow to the kidney, reduces kidney function, so you end up with problems there, and so on. A majorly important thing. Simple things you can do to help reduce your blood pressure whilst you're on a cycle of anabolic steroids or prohormones. Number one, get some regular cardiovascular exercise alongside your weight training. 2 or 3 sessions a week, 20 to 30 minutes at a time. Quite high intensity, so interval sprints or something like that, that will help in itself. Have a knock-on effect in that it will reduce your body fat, reduction in weight, reduction in body fat level, that will also help to keep blood pressure under control, so it's a win-win for cardio. Second one would be more of a nutritional intervention. It's a long list, but the simple ones that we start with. Number one, be adequately hydrated. If you're dehydrated, blood pressure will spike. If you get enough fluids coming into your body every day, that's the number one thing we can do on the diet side to keep blood pressure at normal level. Second one, increase your intake of potassium and decrease your intake of sodium. Most people on a reasonably strict bodybuilding diet will have a relatively low sodium intake anyway, but to be honest with you, the number of people I see day to day that are actually following a good diet is pretty slim. So, fairly simple. If you're on cycle, knock the junk food on the head, alright? It's loaded with sodium. Check your labels as well, day-to-day foods that you're eating, sauces and so on. Look for versions that are lower in sodium, and also increase your potassium intake either supplementally with simple multivitamin mineral tablet with high potassium content, or through foods that are high in potassium. I'll give you a list underneath this at the end of the day. Okay? Next things you can do, a long list of supplements basically. Number one, sounding a little bit crazy, beetroot juice. Okay, 500 ml a day of beetroot juice will reduce your blood pressure. Nice, simple. Next one, it's also food intervention, no drugs. Celery. Celery contains an ingredient in there that will, again, reduce blood pressure. You can buy it as a tablet, but it's quite difficult for the companies to actually standardize the extract from celery. So the best way to do it is just to eat the whole thing. So 4 stalks a day of celery will have an effect in reducing blood pressure. Next one, it's a food intervention as well. Hibiscus tea. Okay, if you go out to the supermarket, the tea section, you'll see all these fruit-flavored teas. Okay, main ingredient in all of them is hibiscus. Any tea that has hibiscus as its number one ingredient, 3 cups a day will reduce blood pressure to a similar degree as ACE inhibitors in people with mild hypertension. It's a fantastic result for pennies. Okay, so beetroot juice, 500 ml a day, celery, 4 stalks a day as part of your food intake, and hibiscus-based tea, 3 cups a day. Moving on from there, get into the more sort of supplemental based things. Number one would be fish oils. 5 grams a day of a decent high fish oil. Again, that's going to have a good effect on blood pressure. It's also going to have a good effect on your blood lipid profile, your cholesterol. So again, that's a win-win for you there. Hawthorn berries, readily available as an over-the-counter supplement. 300 milligrams 3 times a day, so 900 mg a day. Good effect of those there. And the last one I would look at would be coenzyme Q10, CQ10. You can take it in isolation, or you quite often see it as part of a multivitamin, multimineral complex. That's an antioxidant, also has a good effect in terms of reducing blood pressure. So there's a little laundry list of things, alright? I'd say if you were going to do any one of them, make it the hibiscus tea. If you were going to do 2, hibiscus tea and the celery. And if you were going to do 3, I'd make number 3 the fish oils. Okay? Ideally, the way to do this is just get your blood pressure checked. If it's over, well, difficult to say exact, but if it's over about 140/80, I'd start to get worried. okay, I'd start to want to medicate against that a little bit, at least with foods. If you find it only increases when you're on cycle, that's great, because it means that the only reason the blood pressure is increasing is because of an increase in blood volume from the increase in size. You still need to do something about it, but the nutritional strategy should be enough. If your blood pressure stays elevated when you come off cycle and does not go down, does not respond to treatment in terms of foods, doesn't respond to a clean diet, hibiscus tea, celery, whatever else, get yourself to your GP, get it checked out. Alright? It's too big a thing to screw up. Okay, next little episode, we'll have a look at the liver function, what we can do to aid it. Until then, please take care of yourselves. I'll speak to you soon.